A 14-year-old boy presents to the orthopedic clinic following a fracture which was treated locally 1 month back. Your task is to examine the elbow joint. We are going to see about the examination of the elbow joint, and my name is Dr. Anand Srinivasan. Elbow examination usually comes very rarely in the clinical examination as it's quite easier, but we shouldn't miss certain important points. As with any joint examination, we start with introduction, confirming the patient's identity, washing your hands, explaining the procedure, confirming if there is any pain, check the understanding if they understand about what the examination involves, and expose the patient, usually the shoulder joint, at the both the until the waist and the chest. You proceed along the normal examination, which follows the look, feel, move, measure, and the other sides. We scan the area and look for any mobility aids. We make the patient to stand up and look for any postural abnormalities. Observe the elbow from all the sides, anterior, posterior, medial, and the lateral. Then, with regard to the skin over the elbow joint, look for any skin lesions like psoriasis, any scaly lesions, scars, uh, any for which indicates previous injury, any swelling which might indicate synovitis, and the subcutaneous nodules for rheumatoid arthritis. Look also for any swelling around the elbow joint. So this could be due to synovitis, medial on the lateral epicondyle, and along the radial head. Don't forget to look into the posterior part regarding the olecranon bursa. So where the infection of the olecranon bursa, which is called as student's elbow. Also look for any bony abnormalities which might indicate a non-union or a malunion of the humerus, that's for a supracondylar fracture, or any fractures of the radius or dislocation of the radius. With regard to the deformity, look at the angle between the humerus and the forearm. So normally it is less than 15 degrees. If it is more, if the forearm is deviated towards the medial side, it's cubitus varus, and if the forearm is deviated more towards the lateral aspect, it's called as cubitus valgus. Ask the person to extend the elbow and look for any flexion deformity. So this might be the result of a malunion or because of Volkmann's ischemic contraction. Look at the muscle wasting surrounding the elbow joint. That's the biceps, brachialis, triceps in the arm, and the forearm muscles both on the flexor and the extensor aspects. With regard to the palpation, look for the temperature around the elbow joint. If there is any inflammation, palpate along the joint line to find out if there is any tenderness, and the medial and the lateral epicondyle to check for any epicondylitis. Palpate along the olecranon process and the radial head as well. Look for any swelling, palpate the swelling, and if it is soft, it could be a bursa. If it is a boggy swelling, it could be because of the synovial inflammation, and if it's hard, it could be a bony swelling. Do the just wait for the movement during the make the elbow flexion and extension. Look for any crepitus. One of the most important thing which people miss is the ulnar nerve. The ulnar nerve passes behind the medial epicondyle, so palpate the ulnar nerve, look for any snap or displacement in the ulnar nerve, any radiation of the pain, which might suggest a cubital tunnel syndrome. Also, make have an idea on the regarding the thickening of the ulnar nerve. Compare it with the other normal side as well to confirm that if the ulnar nerve is really thickened. With regard to the movements, we perform both the active and the passive movements in the elbow joint. Keep the shoulder adducted and perform the movements flexion, extension, supination, and pronation. The supination and pronation is usually done with the elbow flexed at 90 degrees and the shoulder joint adducted towards the body. So this is to prevent any movement from the shoulder joint. Ask the person to touch the back of the head, pour water in a jug, and wear a jacket to test the functional aspects of the elbow joint. Ask the person to keep the arm adducted and elbow in a flexed position, and ask him to keep the hand in a pronated position. Ask the person to extend the arm against resistance. If there is a pain over the lateral epicondyle, so that might indicate a tennis elbow. Similarly, with the elbow adducted, with the elbow flexed at 90 degrees and the shoulder joint adducted, keep the forearm in the supinated posture and ask the person to flex against resistance. If the pain is present in the medial epicondyle, it indicates a golfer's elbow. Ask the person to do supination against resistance in the same position to check for bicipital tendinitis. So with this we come to the end of the elbow joint examination. You need to perform other tests which involves the shoulder and the hand examination is and a complete neurological examination which involves the sensory and the motor and the reflexes as well. Thank you.